now I'm going to get angry, by the way, because when I say that they're starting to say the quiet parts out loud, in a way, I'm not being hyperbolic, people. I like that word. I'm not being hyperbolic. It's becoming abundantly clear that people have been lying. And when government officials and government-appointed medical doctors have been lying, and they effectively come out now and admit that they have been lying, there's the political solution. There should also be something of a judicial solution. This is Kieran Moore, the Chief Medical Officer of Ontario. You know what? Before I show you my montage, let me just show you the unedited, so you can hear what Kieran Moore, Chief Medical Officer of Ontario, is now saying, as though they've been saying it all along. Oh, I'm sorry. Also, first disclaimer, or all disclaimers. No medical, no legal, no election fortification advice. Super chats, YouTube takes 30% if you don't like it. We are simultaneously streaming on Rumble. They take 20% of Rumble rants. So you can support me there. It'll be better for the platform, better for me. Or you can support at vivabarneslaw.locals.com. I had dinner with Barnes last night. No medical advice. I am not dispensing medical advice. I'm not repeating anybody's message. I might be repeating other people's words. In fact, I won't even be repeating them. I'll just show them. But this is what the Chief Medical Officer of Ontario is now saying. And they're going to pretend that they've always said it. They're going to pretend you did this to yourself. We never forced you to do anything. And I can't find the tweet now. Hold on. Let me just go back. Share screen. What's my problem? Wait until you hear what he has to say. And then we're going to parse it. We're going to break it down.
Why not just recommend it to everybody instead of saying it's a personal decision?
Because at present, we're doing a risk-based approach.
What's the risk?
The risk, there's always a risk to having any therapeutic versus a benefit. You want to make sure there's a very strong benefit versus the risk. If for an 18-year-old healthy individual, the risk to getting hospitalized if we have no underlying medical illness is very, very low. We know there is a risk, a very small risk, 1 in 5,000 that may get myocarditis, for example. And you'd have to have that discussion on the risk. Complication for vaccine versus a benefit of decreased hospitalization for a young, healthy person.
Why not just recommend it to everybody instead of saying it's a personal decision?
Why not recommend it to everybody instead of just saying it's a personal decision? Hey, spoiler alert. It's not that they already didn't recommend it to everybody. They compelled pretty much everybody, carte blanche across the board, to get it. Compelled in the sense that no one physically imprisoned anybody. Nobody physically held them down and stuck anything into their body. But they said, if you don't get it, quarantine. If you don't get it, you lose your job. That is, for anybody who has never lost a job or understood what that means for a family, for people who are trying to support themselves and pay rent, pay mortgage, that is effective coercion. So this reporter is asking the question, why are you not just saying, give it to everybody? Why are you saying it's a choice issue? And he's saying, well, because, no, excuse me. For the last year, it has been effectively coerced on everybody. It has not been you assess your own risks. It's been do it. We're not mandating employers to do it, but we're basically mandating employers to do it. If you don't do it, you can get fired. Oh, but it was a personal choice. You have to weigh your risks. But okay.
Why not just recommend it to everybody instead of saying it's a personal decision?
Because at present, we're doing a risk-based approach.
At present, we're doing a risk-based approach. That means prior to present, they were not doing a risk-based approach because they weren't. They were doing flat across the board, mandatory. Mandate or lose your job. Fire healthcare workers who don't submit. Employers can fire. CBC has it as an employment requirement. CBC, the state broadcaster, has it as an employment requirement in their in their, what do they call them? Job postings on LinkedIn. I follow them just because they make me sick. But it gets worse.
What's the risk?
What's the risk?
The risk, there's always a risk to having any therapeutic versus a benefit.
Oh, excuse me. Excuse me, sir. Did you just call it a therapeutic? Let's play my montage now. It is becoming abundantly clear that people need to go to jail for what the government has done over the last 3 years. Let's just show you my montage.
I just recommend it to everybody instead of saying it's a personal decision.
Because at present, we're doing a risk-based approach.
What's the risk?
The risk, there's always a risk to having any therapeutic, to having any therapeutic versus a benefit. You want to make sure there's a very strong benefit versus the risk. If for an 18-year-old healthy individual, the risk to getting hospitalized if we have no medical illness is very, very low. We know there is a risk, a very small risk, 1 in 5,000 that may get myocarditis, for example. And you'd have to have that discussion on the risk benefit of a complication from the vaccine versus a benefit of decreased hospitalization.
Hold on 1 second. I still hear it in my ear and I have to shut the window properly. Here we go. A therapeutic.
Having any therapeutic.
There's always a risk to having any therapeutic. Well, they're just, this is the chief medical officer of Ontario now referring to what people have been insisting is the big V. He's calling it the big T now. It's always been a therapeutic. It's always been a therapeutic. Now, once upon a time, people, this is from Forbes. Some are claiming COVID-19 vaccines are not vaccines. Oh, I'm sorry. Did I not just hear the chief medical officer of Ontario, Kieran Moore, refer to it as a therapeutic? Not a vaccine? Do words mean nothing? Men are women. Men can have babies. I'm not a biologist. There are always risks to therapeutics. Forbes, what year is this? September 2021. 9 months ago. Some get out of here. I don't want to sign up to your crap. Some crazy theorists, some crazy out there selfish extremists are claiming COVID-19 vaccines are not vaccines. Do I need to play Kieran Moore referring to it as a therapeutic now? And wait till you read the quality journalism here. Writer Alex Berenson, writer, by the way, a writer, not a journalist, not someone with a proven track record of fantastic insight. He's a writer. He's Stephen King. Writer Alex Berenson recently tweeted out the following about COVID-19 vaccines. Don't think of it as a vaccine. I bet you he got in trouble for that. I bet you he might have even gotten sanctioned by Twitter. I bet you, because I know it to be the case, that people on social medias who made this statement a year ago, 9 months ago, were penalized for it. Maybe were deplatformed. Maybe were ostracized. Maybe even lost their jobs. Maybe had the social media virtue signaling mob come after them. Look, don't think of it as a vaccine. Could we think of it as a therapeutic, like Chief Medical Officer just confirmed? Oh, why do I keep missing this stupid? Here we go. Don't think of it as a vaccine. Oh, okay. So how should one think about the COVID-19 vaccine then? As a turnip? Oh, you're so sassy. So sassy and so insightful. Yes, think of it as a turnip. You idiot. As a cat wearing a bandana? Oh, you're so creative. Well, Berenson continued with, think of it as best as a therapeutic with a limited window of efficacy and terrible side effects and terrible side effect profile that must be dosed in advance of illness. As you can see it in the following screen capture. Oh, look at that. Alex Berenson, it doesn't stop infection or transmission. Don't think of it as a vaccine. Think of it at best as a therapeutic with a limited window of efficacy and terrible side effect profile that must be dosed in advance of illness. And we want to mandate it. This tweet is misleading. Learn why health officials recommend a vaccine for most people. Just in case we forgot, people. Just in case we forgot.
Instead of saying it's a personal decision.
Because at present, we're doing a risk-based approach.
What's the risk?
The risk, there's always a risk to having any therapeutic, to having any therapeutic.
I think I've made the point. It's preposterous. It's preposterous. And there's always a risk to having any therapeutic. 9 months ago, Forbes berating anybody who's wacky and out there enough to say, don't think of it as a vaccine. Think of it at best as a therapeutic. Oh, I'm sorry. Now, by the way, what happens now? Are we allowed quoting the chief medical officer? He's CMOH, Chief Medical Officer of Ontario. Are we allowed quoting that guy? Are we allowed repeating what Kieran Moore just said without getting yeeted from social media? And by the way, extremely rare circumstances of myocarditis, extremely small risk, 1 in 5,000. Let's just assume that that's the number. But I don't think, in my legal analysis, if they're coming back now and saying, yeah, it's not a V, it's a therapeutic, they're going to come back now and say, 1 in 5,000. I suspect in 6 months it's going to be 1 in less than 5,000. But let's just even operate on that number. 1 in 5,000 is a very small risk. I'm sorry. If 1 in 5,000 is a very small risk, what was the risk of hospitalization for teenagers in the first place from the Rona? Let me just see. I don't know if I'm going to be able to find it. It's infinitesimal. If 1 in 5,000 is a very small risk of myocarditis for a young and healthy individual, then how would you qualify the risk of COVID in and of itself for that same individual? Because I'll tell you one thing, I know it's more rare than 1 in 5,000. Risk of I'll see if I can get it. Hospitalization, COVID, teens. Risk of infection. I mean, we're talking infinitesimal. If 1 in 5,000 is small, then we're talking infinitesimal. Let me see if I can find a new study found that 179 individuals aged 12 to 18 years hospitalized for COVID-19 in 2021. I won't be able to find the stat right now. I should have had it before, but if 1 in 5,000 risk of myocarditis for an otherwise healthy teenager is very, very low risk, that's exponentially more risky, at least in terms of statistics, than any meaningful hospitalization. And I wouldn't even say death, because in Canada, I believe last I checked, 2 deaths under 19 attributed to COVID-19. And even that I don't necessarily trust, because we saw what they tried to do with one of the cases, the 14-year-old boy with stage 4 brain cancer in Alberta, that the chief medical officer of Alberta, Dina Hinshaw, said died from COVID, and other factors that played into it. Yeah, stage 4 brain cancer, being in a coma. If they did it once, they've done it more than once. No, just overnight, by the way. We've never forced it. It was a therapeutic. It had 1 in 5,000 risk. Very small. You did it. You chose to do it freely. We never made a blanket mandate. We never had vaccine mandates. We never had vaccine passports in Quebec. No. Yep. Well, not way more than contracting. Way more than having any meaningful hospitalization or death for that age bracket. It's infinitesimal severe infection. And even then, no, therapeutic. But Berenson was yeeted from the tweets for saying something similar.